we are, of course, very proud to be here with Senator Hancock and the Clean Money Campaign and our allies in One Care for single payer in California. I think that just as you said, the reality is in Washington that the healthcare debate is being determined by campaign contributions. And it's being determined in two ways. One is that money buys access, and number two, it is being determined by the preemption of certain options, specifically a Medicare for All program and a truly robust public option. What happened is because essentially, and for legitimate reasons, the administration was afraid of what the Association of America's Health Insurance Plans, AHIP, the trade association for the health insurance companies, would do. They were afraid of what pharma, the trade association of big drug companies, what they would do. They cut deals with them. And those deals are how the debate got preempted. And you don't, the amazing thing is that yes, the health insurance industry, the HMOs, the drug companies, you look at the whole consortium of the medical industrial complex, they have spent something like $287 million in campaign contributions to all the different members of the committees of jurisdiction in the House and Senate. That money alone is enough to scare off the administration or leaders of Congress from enacting a more ambitious healthcare reform program that would actually solve our crisis and take on those special interests. So you can spend the money for access and you can spend the money preemptively. We also know that in California, that those drug companies and insurance industry, HMOs, hospitals, and nursing homes have contributed over $280 million to candidates and initiatives in California since 2000. So that amount of money, $1 million, $2 million a day, obviously determines the contours of the debate. And so Senator Hancock is right. We're at the California Association, we want meaningful healthcare reform, and we have determined that the only way to get real reform is to get those deep pocket special interest money out of the game so we can actually put the healthcare needs of the people front and center in the policy debate. We can't even have a policy debate. And the nurse leadership, and I think you talk to direct care nurses individually, they'll tell you increasingly they fear that they cannot take care of their patients in the way that they deserve because of the influence on really that shapes their work life. It shapes the kind of care they give, how long their patients are in the hospital, what treatment options they have, the education they get, the kind of preventive care they want to deliver. All those choices are determined by the insurance industry increasingly, and those insurance industries ones are buying the policy-making apparatus. And so they feel like they can, without curbing the influence of those campaign donors, they actually cannot give the care that patients deserve. And that's an amazing thing if you think about it. And healthcare is one of the most personal experiences that we have, and yet it is the big money of these insurance industry, HMO, and drug companies that's determining on the most personal level the kind of care that we get. That it has perverted our political process to the extent that our doctors' choices and the care that nurses give are determined by them. I mean, I think it's unconscionable. And it does rise, from that perspective, it does rise to a moral question. And so we put on the ballot Prop 89 in 2006, and it was kind of a moral crusade. It was a big, do-it-all kind of, what we call clean money initiative. And this initiative, on the other hand, is more targeted, more specific, because we waged the big campaign. It was a tough campaign, didn't succeed, worked with our allies here. But we regrouped and realized, let's take this one step at a time. Let's take another run at it with the Secretary of State's office. You say, well, what does the Secretary of State have to do with health care? Well, it has everything to do with health care, because the character and content of our political campaigns, and what is a campaign that needs more issue focus than the election officer of California? I mean, do you want the special interest buying the election officer in California? I mean, it's one thing to buy all the candidates and buy the elections, but do you also want to buy the referee? It doesn't seem quite right. So it's a great place to start. And it, we think will lay the foundation for winning the reform broadly, to really finance our elections. And we're happy to run against the lobbyists. We're going to run against the drug companies, we're going to run against the insurance industry, we're going to run against the HMOs, we're going to run against their lobbyists, because they're the ones determining the kind of patient care we get in this state, and it's unacceptable. And we are so proud to be here because of the righteousness of this cause.